minutes just so that we could get to know each other. And then we'll receive information about the vaccine, and then we'll have our planning committee election. There will be announcement on lobby day, and then we'll have out of gas presentation by Yua, and then we'll have our closing remarks. Just a little bit of Zoom housekeeping. Just remember, don't overpopulate the chat box. Stay on mute unless you're asked to speak. And then to raise hand, it's just like at the one of the functions on the bottom. And then if you're on your phone, you can press *6 to mute and unmute, and then *9 to raise your hand. And then the mute button's on the lower left. So that's there if you need to unmute yourself. But just remember the community agreements: be present and participate, only one microphone at a time, speak from the I perspective, move up and back, and then just remember to land your plane. So get your point across. And then respect other points of view, and then this is a judgment-free zone. So with that, I will pass it back to Charles to do our breakout rooms.
How you doing, everyone? And I hope everyone's having a wonderful winter. And it is winter. Winter is here. We're getting a lot of snow. I have not seen this much snow in a long time in New York City. So the next thing we're going to do is we're going to do some small breakout rooms. Beleen, let's do this. There's approximately 60 people.
I was going to make 12 rooms to have about 4 or 5 people in each group.
Let's do 12. That'll be fine.
Okay.
So in the small breakout rooms, we have a question for everybody. And the question is this: one person of color who has influenced your life. One person of color who has influenced your life. So I need you guys to think about that question and share it with each other. And then that'll be it. So, okay, Blaine, hit the breakout rooms. Everyone join.
Hi, everyone who's in my group. Is everyone muted? Okay. Does anyone want to start? Paraji Falcon and Sarah Jen. Okay. Hi, Federica. So we're just, since you just joined in, we're having some breakout rooms to share one person of color who has influenced your life. So it can be a historical figure, a family member, or anybody. So if you guys are there, and if you have someone in mind, go ahead and unmute yourself and share.
Hi, this is Caradwan. Sorry, I'm joining a little late.
Oh, that's fine. Did you get to hear what the prompt was?
Yeah, so one person of color who's influenced my life?
Yes.
Okay. For me, first thing that comes to mind, I've been rereading a lot of Toni Morrison, and I reread her books like almost every year. I feel like I have to go back and just list. She leaves me with such a feeling, but to remember the words. So that's somebody who's, I guess, kind of a larger influence, not necessarily a personal one. On a personal level, I have a friend from school who, during the protests this summer, tried to do some fundraising just on her Instagram, and she was planning to raise like $500, and she ended up raising close to $30,000 for, different, organizations and groups related to funeral costs, or organizations working to fight police brutality and all that. So she was somebody who's really inspiring to me, because I didn't think somebody my age could make such a difference. So she's really great.
That's awesome. I love Toni Morrison. She's like, oh, amazing. Anybody else want to share? Well, I would say for myself, my grandmother has just been always like that one person in my life who's like the pillar or the foundation of who I am, and what I identify to be as a strong Black woman. So I would say my grandmother. Hi, Alicia, sorry. So since you just came in, if you didn't hear the prompt, we're basically sharing one person of color who has influenced your life. So it can be a historical figure, it can be a personal relationship with somebody like family member or anything like that.
Great, thanks. I am locked out of my apartment right now, so I'm waiting for the key, but I would say my mom is probably that person for me. She sort of, she's a Sri Lankan, Jamaican woman who kind of lived all over the place and then became the founder of an Africana Studies department at her college, and I think has taught me a lot of important things about my heritage and radical history that comes along with all of that would have been totally lost for me had I not had her around, because all of that heritage and family is overseas. I grew up, in really whitewashed worlds in big cities and in school and stuff. And so I'm really grateful for that, and I'm also grateful that she followed me to New York City, where we can now work on radical projects together and have someone keeping me honest. Thanks.
That's awesome. I wish I could convince my mom to come to New York for us to just have fun and kick ass here. Anyone else? We have about 10 minutes, 10 more minutes. Frederica says, the person that inspired me the most is my dad, Vincent Matisse. He was a contractor and only had a 5th grade education. And he has been able to build roads, schools, read blueprints, and farm and employ many neighborhood men. I learned about she learned about real estate from her father and how to manage money. And he was and still is her hero. That's great. Thank you for sharing that.
Hi, my name is Patrick. Person of color that really influenced my life when I grew up in a very homogenous society in rural Ireland. And when I left my hometown, I met this fantastic man called Mohammed living in Dublin. He was born in the Sudan and moved to Ireland when he was 20 years old. And he'd been living there about 8 years. And he taught me a lot about what it was like to exist in a multicultural society and what it was like to live in a country that you didn't really feel comfortable in. And when I moved here to America, all the things that he would talk to me about when we lived in Dublin really influenced the way I became an American.
Mm. That's great. Thank you. Yeah, sometimes, me as well, coming from an international background, race and, that whole complex is seen differently or structured differently in different countries and continents. And America is very much unique in that aspect. Okay. 7 more minutes. You guys are doing great. Thank you so much for coming and joining us this morning, even though it's early. Oh, okay. For the question is, what is one person of color that has influenced your life? So it can be a historical figure, or it can be a family member, like personal relationship or anything.
Good morning, everyone. I would say Malcolm X was definitely someone who inspired me a lot, person of color who inspired me a lot. And that is because, despite all of the, systematic oppression that he went through, like especially starting from a really, really young age and having gone through the, like basically falling into the traps of like this empire and conquering it. And not only that, but striving to become one of the most influential, like, liberation, leaders within like our, time frame. And I think that's like super profound. Like, no matter how much this country intentionally tries to like break you down, like he was able to transcend that and dedicate his life towards like, breaking that system down. And he did it in a really special, unique way. I think that was definitely something.
Yes, Malcolm X is a good one. Is okay. 4 more minutes. Hi, Jenna. And I think maybe Julia is new to, or just came in. So we have about 3 more minutes. So if you guys have in mind, quickly share a person of color that has influenced your life, and it can be a historical figure or someone that you know personally. If you don't want to speak, you can also put in the chat. Oh, Fode said Fannie Lou as well. Can you tell us more about Fannie Lou? I kind of recognize her name, but I forgot. Jenna said her grandparents. Hi, Juan. Hi, William. Do you guys want to share? If you want to share someone, a person of color that has influenced your life, go ahead.
Oh, are we coming back as a one big group now?
We will in a minute.
Oh, okay. Yeah, I just broke out of my group.
Oh, okay, that's fine.
I was like, we're doing.
This is the leftover group.
Oh, okay, so you're taking all that. Okay. No, yeah. I decided to press leave the group. I thought that's what we had to do. So.
Okay, I'm about to do that now, anyways. Thank you.
Okay.
Hey, everyone's coming back in.
Hello, everyone. How's everyone? I hope you guys really had an opportunity to really think about that question, considering that it's Black History Month, and I wanted to make sure that everyone kind of thought about that process. I hope everyone was like, we had some people who could not even think, but it was a tough question, and it's meant to be that way, to make you think about that. So next on the agenda is our vaccine expert from the Department of Health. And I'm going to pass this over to Solno.
Charles, our speaker is not yet present in the room, so we'll have to wait for them to join.
So and then what we'll do now is actually, does someone want to report back of what they felt about the question? And also, just kind of what they felt about the question and the importance of what they felt around the question. Anybody want to report back real quick?
I'll go for it, Charles.
Okay.
So in our group, it was very, very interesting. Everyone, as we talked about everyone, historical, there's so many people that we all ended up kind of remembering those who are closest to us, our fathers, our mothers, sisters who have made such a great difference in our lives. And we've kind of, not that we forget to recognize them, but we don't always look at the people who are next to us. So a lot of us definitely remembered the people in our own circles who have made such a great difference in our lives.
Okay.
Yeah, I can go next, Charles. It's Christopher.
Sure.
So in our group, we had Juan, Mr. McCabe, Beverly, John, and for a bit, Miss Shepherd. And what I loved about our group was it was similar, Wendy. Like we had a lot of people first mention people in their lives that taught them how to, achieve success and how to be a good person. So people's wives, their mothers, their fathers. And then we had some just remarkable human beings in our country's history. Folks like August Wilson, the playwright, Ella Baker, Fannie Lou Hamer, and Martin Luther King. And Mr. McCabe, William talked about just someone who, in his graduate study program, encouraged him to leave climate science and pursue, not so much leave it, but move more towards environmental justice. I hope I said that right, William, which I thought was really fantastic.
Yeah, exactly. Thanks.
So.
Anybody else want to report back real quickly?
Charles, I can say something.
Yes, please do.
First of all, I just want to say I was personally really moved by the question, and I really like kind of centering the stories of people of color in our lives and getting to have space for that, particularly during this month of February. People in my group mostly said people that they're personally connected to, which was great to kind of step back and get to reflect on that. And someone also mentioned Cecil, who had brought him to this organization. So it was great to remember Cecil.
It's always great to remember Cecil. Yes, it's always great that. Thank you so very much. Anybody else that we have can report back? There were 12 groups, so I'm just needing one more to kind of like fill out and making sure that we are reporting back to our thoughts.
This is Rachel. We got all done, and I realized that my daughter-in-law, who is just fabulous, I love her, we're great friends. My daughter-in-law is Mexican and is 40% indigenous and is dark, and I guess she's a person of color. And I forgot. When you mix it up with people, you forget. And I'm Jewish, and if we don't take care of our democracy, I'm going to be right behind the supposed people of color. I'll be next in line, because if you're going to play race games, then you can decide who's in the race. So we've all got to deal with this one way or the other.
All right, we certainly do. And I appreciate your thoughts, and I appreciate you recognizing your daughter-in-law. All right, I just saw the, Sono, did he come in?
Yes.
Okay, so the next move is Sono's going to introduce a resident expert on the vaccine from the Department of Health. So Sono, go ahead, please.
Hi, everyone. So today we are going to have a really special presentation about the vaccine. And really, this is meant to just make sure everyone has, the information they need to have. We answer some questions that a lot of people have been wondering, and we, are addressing anything that people are worried about, really. So without further ado, I'd like to bring up Dr. Torian Easterling. He is the first Deputy Commissioner and the Chief Equity Officer. He is currently the agency's top deputy and plays a chief coordinating role in the COVID health pandemic response. So prior to serving as a deputy commissioner, Dr. Easterling served as an assistant commissioner of the Department of Health's Bureau of Brooklyn Neighborhood Health. In his role, he launched the Brownsville Neighborhood Health Action Center, co-led the agency's NYC Birth Equity Initiative, which works to eliminate racial inequities in severe maternal morbidity and infant health outcomes, which is something we all talked about just a couple months ago. Dr. Easterling holds a Bachelor of Science from Morehouse College, a Doctor of Medicine from Rutgers, New Jersey, and a Master's in Public Health from the School of Medicine in Mount Sinai. So without further ado, I'd love to welcome Dr. Easterling, and we have some slides that will go with it. Handing it over to you.
Thank you so much. Good morning, everyone. Thank you so much for the invitation to be here. Really appreciate the time, and I know that there's been a commitment from this organization to really support environmental health overall, but also just thinking about health outcomes in the communities that we serve. So I also just want to wish everyone happy Black History Month, happy Heart Health Month, and I know that there's so much more that we need to do to get out of this pandemic, and so we're looking forward to the work ahead. With that, I do have my colleague, Pauline Ferrante, who's going to assist me and is going to put up some slides. The slides will be brief, really just to show sort of where we are in this pandemic and just provide an update on COVID-19. To start with, we'll go through some of the data and then we'll jump into our vaccine update. And so the first slide is going to give you an overview of what we're seeing as far as our cases and our test positivity. Wait for Pauline. But I will say that the important part here is that there is cause for concern, even though you'll see over the last month and a half that we've been able to turn the tide, so to speak, and we're seeing a decrease in all of our major milestones. And so the major milestones that we look at are our daily case number. We also look at the number of individuals who are testing positive, as you will know that as our percent positivity. We're also looking at our hospitalizations. We do look at that regularly per capita. And then we're also looking at deaths overall, confirmed and probable. And so you'll see over the last month, we have begun to see a decrease in the number of cases in our percent positivity. Last month, our percent positivity was as high as 8.8%. And so that is really high given the number of people who have been getting tested across the city. And so that the denominator is the number of people who are tested, and the numerator is the number of people who are testing positive. And so you'll see on the left-hand side of the slide, this citywide map, and you'll see that there are many neighborhoods, and particularly the neighborhoods that we've been paying attention to and have really been elevating some of the inequities that have been existing in the city for quite some time. That would include, Eastern Queens, Northern Manhattan, the South Bronx, North and Central Brooklyn. And so it speaks to the need for us to continue to elevate our messaging around our core four and individuals getting tested. The presence of new variants certainly are concerning because the conditions which lead to structural inequities have not gone away. And so we know that there are individuals who continue to remain in overcrowded housing conditions and may not feel comfortable safely separating and using our hotel service. We know that many folks are continuing to serve on the front line in essential roles. And this increases the risk of exposure to COVID-19 into the variants. And so certainly we want to make sure that individuals know that while we are rolling out our vaccine plan, we certainly need everyone to continue to do all the things that we know that work. And so with that, next slide. And then just to look at it by borough, you'll see we do look at this, the percent positivity. Again, the denominator is the number of people who are testing based on their home residence, and the numerator is the number of people who are testing positive based on their home residence. And so we look at this by borough, we look at this also by zip code. And so you'll see certain boroughs where the percent positivity is much higher, certainly higher than the citywide average. And you'll see for the Bronx, that is the case, where percent positivity is at 10.74 compared to the citywide test positivity. And this is as of now. And this data was lifted from our page from data from yesterday. And then you'll see Brooklyn data here where the percent positivity is 7.94, where compared to the city. And you also just look at the map on the right and see the neighborhoods that are shaded in darker red in Southern Brooklyn. It's really what's driving the high percent positivity for the borough. Next slide. And then for Manhattan, we're certainly seeing a much lower percent positivity, 4.21 for the borough of Manhattan compared to citywide rates. I'll just also mention that when you look at our vaccine data, we certainly know that higher number of residents in Manhattan have been vaccinated. You'll know by the Central Park, particularly in that area, many of our hospitals are located in that area, Midtown, Upper East Side. You have Mount Sinai, and then also you know that many of the hospital staff, residents, the attendings live in those areas as well. And so, just sort of giving you some context of the landscape and how we're looking at the data as well. Next slide. Our Queens data, you'll see that the percent positivity is at 9.59 compared to the citywide average, and you'll see some of the neighborhoods that are shaded in red. And certainly, we continue to look at the work that we need to do in Far Rockaway, making sure that we're supporting the residents in Far Rockaway, making sure that they're getting tested and the resources, and also ensuring that they also are doing all of the core 4. Next slide. And then looking at Staten Island, you'll see percent positivity at 8.58 compared to citywide. Certainly, we've seen the entire island, the percent positivity has been elevated for quite some time, both northern, mid, and southern shore, and certainly the work that we continue to do, both in just making sure that folks have access to testing resources, but we also are looking at the access points for vaccine distribution. So, I think the upshot here is that, we're not out of the woods yet. Everyone is now vaccinated, and certainly as a vaccine is in our toolbox, we have other tools in our toolbox, and we have to keep using them. And so in order to stop the spread, we have to continue to do our core 4 prevention strategies, which are listed here, wearing face coverings, staying home if you're sick, keep 6 feet of distance, and washing your hands. Folks will know that recently the CDC did put out more guidance, and we are updating our website to reflect CDC's guidance around face coverings, really making sure that individuals are using face coverings with some type of wiring at the bridge of the nose, so that you can really make sure that you are applying and pressing the bridge of the face mask against the nose and really trying to cover that area, because it's really, really important, as there have been some studies to show that when there's loose fitting, that aerosolized particles can seep into the areas underneath the mask. So really, really important. Not to say that we are recommending that individuals need to wear 2 masks, but if the one mask can really be applied to the face closely, I think that will be really, really important. And so we're continuing to look at those recommendations. In addition to the core 4 prevention strategies, also avoiding travel and gatherings, and we continue to elevate the Commissioner's Health Advisory. We are continuing to want to protect our older adults, our older New Yorkers, the people they live with, the people with underlying chronic conditions, their caregivers. And so, again, while we are rolling out our vaccine outreach, it is really important that We try to minimize and limit our travel, staying close to home, certainly avoiding any non-household gatherings, really important. Next slide. And so with that, I'll transition into our next group of slides and really talking about our vaccine distribution plan. The city launched our New York City Vaccine for All in December, focusing on equitable distribution, keeping equity at the forefront, acknowledging the history, both historical and contemporary injustices, and that experience continually needs to be validated and acknowledged as we are rolling out our vaccines across New York City. Our work is to really make sure that we are, building confidence in the vaccine. And so that's trust in the vaccine, but that's also making sure that we're working to earn the trust of New Yorkers. So that communities know that we are working for them, that we're really making sure that they have the access to the vaccine, and then that we're addressing their questions. We launched the Vaccine Command Center mid-December, which is an interagency operation led by multiple agencies, including New York City Department of Health, Health and Hospitals, New York City Test and Trace, and many others, being led by our Deputy Mayor of Health and Human Services, Mel Hartzog. And really, it's important for us that we're focused on our partnerships. And so we work with a number of community-based organizations, faith-based organizations, and also continue to work with the federal and state to make sure that we are in line with the guidance that is out, but also, once additional guidelines are issued, then we're able to apply it at a local level. Next slide. And so the basics are that, it's really important. Vaccines are safe. They have undergone rigorous testing. They are certainly recommended even for individuals who have been previously infected for COVID-19 or have antibodies. Certainly, if you're currently infected, have been recently tested, you'll want to hold off from going anywhere, including to go get your vaccines, so not to expose anyone else. The vaccines, both vaccines that are available right now are mRNA vaccines. They do not contain the virus, and they do not alter the genetic code, your DNA, your nucleus in any way at all. The two vaccines that have been currently issued emergency use authorization are the Pfizer and the Moderna vaccine. Both require 2 doses. As I mentioned, they're both mRNA. And the way that you think about mRNA is, think of it as sort of the instructions. And the mRNA is sort of instructions to how to build a protein. And that protein code is the protein that's found on the spike. It's a spike found on SARS-CoV-2, or the virus particle that is causing this COVID-19 pandemic. And so once you have those instructions, the instructions are sent into your body. Your body then recognizes the instructions that have been sent, replicates that spike protein, deletes the instructions. It is, again, it's not entered into your DNA or any way, form, or fashion. Deletes the instructions, replicates the proteins, and then the antibodies that are produced will then get rid of the proteins. And now your body has those antibodies. And so anytime that your body then recognizes that you have been exposed to that spike protein that can be found on SARS-CoV-2, then you're able to recognize it and get rid of it. And so that's how vaccines work. They protect us against any type of foreign particle. And so those vaccines, 2 doses. The Pfizer vaccine has been approved for individuals 16 and older. You can take your second dose 3 weeks after the first dose. The Moderna vaccine is eligible for individuals 18 and over, and you take the second dose 28 days after the first dose. Really, really important that even after you complete the series, 2-dose series, it is important that you continue to do all the things that we just mentioned about Core 4. We are not clear about the length of immunity or how, if you can transmit the SARS-CoV-2 to someone else even after you're vaccinated. And certainly it's really important that you continue to wear your mask even directly after, as we know that to have full immunity, it takes 2 weeks after after that second dose. So the upshot is keep wearing a mask. We work with the federal government to ensure that we get our supply. And so on a week to week, we're allocated anywhere between 100 and 200,000 doses. That includes first dose and second dose. We work with the state to ensure that allocation is approved. And then we also work with the state as the governor sets the criteria for who is eligible. You can find out who is eligible on our website at nyc.gov/COVID vaccine. You will already know that this started off with high-risk healthcare workers, expanded to all healthcare workers and staff in hospitals, as well as staff and residents in long-term care facilities. Then expanded to individuals that are 65 and older, as well as some frontline workers. That included first responders, teachers, childcare services as well. We have stood up a number of different access points across the city. Some of them are specific for certain workforce, such as the fire department, NYPD, correction officers, and healthcare workers. But by and large, we have a lot of public sites where, based on your eligibility, if you're a restaurant worker, TLC licensee, or you are someone that is 65 and older, you're able to schedule an appointment. Supply is extremely limited, and so we're doing our best to make sure that we are getting to those who are most vulnerable. And I think that's really important because, one, we want to protect those who are most vulnerable to severe illness to COVID-19, and certainly thinking about those who are at high risk of being exposed to COVID-19 based on their occupation. Next slide. And so, as I mentioned, because of limited supply, we are going through this phased distribution. Mentioned some of the eligible groups that are currently able to get vaccines. You can see more that is listed here. We do not expect that we will be able to get to the general public until mid-2021. Certainly, we've been hearing very promising reports from the federal government, from the Biden administration, about their work to try to increase the number of doses that are allocated across the country. But we still do not think we'll get there until mid-2021. And so while we're doing that, we're making sure that we continue to do outreach and engagement and partnership to get to those who are eligible. Next slide. And so enhancing our access and building confidence, which is really important. We focus on equity, and it's been at the forefront. We've been thinking about equity in a number of different ways. Access is really important. And so we've looked at our data, and we have obviously data from during this pandemic that have been hardest hit. We know the neighborhoods that have experienced longstanding structural inequities. And so in partnership with the New York City Racial Inclusion and Equity Task Force, we have increased the number of equity neighborhoods to 33 to make sure that we are doing important outreach to those neighborhoods. We've placed access points in those neighborhoods as well, making sure that we're getting to seniors, making sure that we're reaching out to individuals who are eligible. And we're using that data to really make sure that we're prioritizing our outreach. To make appointments, you can go into vaccinefinder.nyc.gov for our city-run sites, state-run sites, FQHCs, and pharmacies. We also have a call line at 877-VAX4-NYC. We're partnering with a number of different city agencies. We're making sure that our information is able to be seen in multiple languages. Our website is definitely, you can translate into the top 13 languages. Our call center has access to a language line. And so if individuals are able to call in, then they are able to also select their language. And transportation is available for our seniors. And that's also important to make sure that we can get our seniors to the sites as well. And then, shifting and really having a very equity frame around hesitancy. And so we talk about building vaccine confidence instead of vaccine hesitancy. As I mentioned, it is our responsibility as government to really earn the trust of New Yorkers, to help support individuals make an informed decision about the vaccine. And so we have to get the information out, factual information, addressing misinformation about the vaccine. So we activate trusted messengers. We work with a number of community leaders. We do a number of different things, from town halls, community conversations, train-the-trainer sessions, I am joining a number of these conversations as I join meetings across the city virtually to share vaccine facts, but also make sure that I'm addressing the question. We have a number of different videos with myself, the commissioner, and others talking about vaccine facts, the work that we're doing. And we have a much more comprehensive presentation, our VAX 101 deck, which is now on our YouTube page, where I go through all of the different details around how vaccines work, the development of the COVID vaccine, our distribution plan, and how we're using equity. We're currently in line to receive 1.7 million doses to New York City. That is both dose 1 and dose 2. Again, this is not all coming to the city. This goes to healthcare workers, this goes to pharmacies. This is for long-term care facility nursing staff and residents. And so when we think about the number of 1.7 million, this is not all coming to the city. So just being clear about that. We have already reached over 1 million doses into the arms of New Yorkers. And certainly if we had the supply, we would have reached this number in January and been on our way to reach 2 million if we had the supply. And we have the capacity to really get vaccines in arms, but the supply has been a rate limiting step. But this is just where we are by the numbers. We do look at data even more granular. One, we look at it by race and ethnicity and age. Just to be transparent, we know we have to do better. When you look at race and ethnicity and age, we know that we need to get more vaccines in the arms of New Yorkers who identify as being Black and African American and Latino communities as well. And this is what we're doing through our partnerships. We're also looking at our numbers by geography and hope to release that data very soon. And so that everyone is able to see it and see the work that we need to do to really do some outreach. As I continue to do a lot of engagement and conversations with communities, we're hearing about the hesitancy, we're hearing about the concerns. And so this is going to take all of us. It's going to be really about the one-on-one conversations. The person I go to church with, my neighbor, family member, talking to them about why they got the vaccine, and I'm fine, and I know it's safe, and I think that will really help us turn the tide. And so what I would ask that we all do is continue to spread the message that vaccines are safe and effective. Vaccines save lives. We have to continue to do all our core 4 prevention strategies. Lots of information is on our website. So I really do hope that you will help us in amplifying this information on all of your platforms as well. If anyone is eligible, certainly please go into our websites and get an appointment. And when you are able to get your appointment and get vaccinated, use your platform so that others know that you received the shot. I received the shot, my first dose on February 7th. And really to build confidence and let others know, as a top-ranking public health official, that vaccines are safe. I had a little soreness in my left arm where I got vaccinated, but that is all. And I, just been looking at this data and know how safe the vaccines are. And I'm slated to get my second dose on March 7th.
Thank you so much, Dr. Easterling, for all this information. This has been very helpful connecting us to great websites and resources. We have a couple questions that the members put together that they wanted to ask you. So I'll just kind of jump right into a couple of them. And members, I noticed you put a lot in the chat. We're not going to have time to answer all of them, but we'll work on getting some answers after the meeting as well. So one of the questions that our members are wondering, what are the side effects to look at for receiving the vaccine? Will it hurt? What should we be concerned about?
Really good question. And the most common side effect is the side effect that I mentioned. Most people will report that they are experiencing some soreness at the site of the injection. It develops usually about 12 hours after the administration, and it can last anywhere between 24 to 72 hours, and it goes away. Some do experience some fatigue, lightheadedness, dizziness, and certainly those symptoms also go away between 1 to 3 days as well. And so those are the most common side effects, and that's really just your immune system saying that the vaccines work and giving a recharge, and it's now beginning to get a reboost.
Thank you, Dr. Easterling. And another question our members were wondering, for those who are reluctant about getting the vaccine, some of them are wondering, why not take my chances with COVID-19 rather than get a vaccine? Can you respond to that, please?
Certainly, I would first start off by saying that the concerns are valid, and we have to provide space for concerns and questions and hesitancy. And so the risk of getting COVID certainly is something that we just do not want folks to experience. We know the downside of it, of not just the symptoms, but the severe illness, the respiratory issues, high risk of being needing or requiring hospitalizations and intensive care. And so that puts even more burden on our hospital capacity, and also the increased risk of death. And so we just do not want individuals to be exposed to COVID-19 at all. And given the data and the science around the vaccines, we see that the benefits of the vaccine certainly outweigh the risk of you being exposed to COVID-19.
Thank you. And another question we have is about the new variants that are coming up. Does the vaccine cover those new variants, and what should we know about that?
Yeah, what we just want to keep in mind, and so we have the technology, we are able to do genetic sequencing for variants, both at the state level and at the city level, through our public health laboratory, and then the state has Wadsworth Laboratory. And so we've been tracking B117, which is a UK variant. There are multiple other variants, Brazil and South Africa, and even the California variant. And so we're paying close attention. We have not seen high numbers of the UK variant, although it has shown up, and we believe that it's been here since November. And so we will continue to test and do genetic sequence. What we do know about the vaccines is that the vaccines are effective. They're over 94% effective for the novel coronavirus, SARS-CoV-2. For the variants, they're not as effective, but they are still effective, which is why it's really important that if you're eligible, it does give you some protection against the novel coronavirus as well as the variants. And so you want that protection. And then we also know that there's more studies being done to look at ways that we can retool the vaccine to also provide additional protection against the variants.
Thank you, Dr. Easterling. And does the vaccine have any interaction or negative interaction with anyone with any chronic illnesses or medications being taken?
Yeah, no, also really, really good question. And for those who do have individuals with underlying chronic conditions, will become eligible to receive the vaccine starting Monday, the 15th. The governor has already announced that individuals with underlying chronic conditions will be able to get the vaccine. And so what we know based on the science is that individuals who are immunocompromised, individuals with underlying chronic conditions such as hypertension, diabetes, there is some data to show that the vaccines are effective, but it's still limited. But what we know is that the benefits of the vaccine still outweighs the risk of being exposed to COVID-19, because certainly with underlying chronic conditions, we know that there is severe risk of illness and death being exposed to COVID-19 if you have underlying chronic conditions. And so, yes, it is okay for someone who has underlying chronic conditions to get vaccinated, and certainly want you to do that. It is really okay, and I support any individual that wants to speak to their provider. I think that it is really important to do that, but do know that the science and the recommendations is that individuals with underlying chronic conditions, it is safe to get the vaccine.
Thank you, Dr. Easterling. We'll just ask about 2 more questions. How long does it take for the vaccine to work? And you mentioned this a little bit, but we're wondering, can you still get COVID after you've gotten your vaccination?
Yeah, to the second question, the answer is yes. You can still be exposed to COVID-19. But I think the important part is then how will your body react to it. And so the expectation is that yes, you can still test positive, you can still be exposed, but you're very less likely to experience any symptoms, and probably won't even know that you have COVID-19. To the first question, just getting back to the 2 doses. And so it's really important that you complete the series. These are both 2-dose vaccines. You'll like, as I mentioned, I took my first vaccine, my first dose on February 7th. Because I took the Moderna vaccine, the second dose is 4 weeks away, 28 days after the first dose. So I'm taking the second dose on March 7th. I still need to be very mindful of who I'm around, period, after I take that second dose. But in order to get to the 94 and over 94% effectiveness, I still need to wait 2 weeks after I take the second dose. That's both for the Pfizer vaccine and the Moderna vaccine. So Pfizer is 3 weeks after the first dose, but you still need to wait 2 weeks in order to get the full effectiveness of that vaccine. And for the Moderna, it's 2 weeks after that second dose as well. And that's when you'll reach the over 94% effectiveness.
Thank you, Dr. Easterling. We'll just drop one more quick one in there that our residents are wondering about outreach to people living in NYCHA. How are we getting the vaccines to them?
Yeah, really great question. And I was just at one of our sites, one of the NYCHA developments yesterday, the Nostra and Sheepshead Bay site. So in partnership with our NYCHA colleagues, where we have stood up 6 sites, as well as our New York City Test and Trace colleagues, we stood up 6 sites across the city where we're vaccinating NYCHA residents, seniors only. And this week, we're doing 80 first doses at each of those sites. And so we're going to be really getting to a number of seniors in all the developments. And we're hearing the stories of just individuals are saying, this is my first vaccine ever in my life. But because my neighbor got the vaccine and said it was safe, then I got the vaccine. Or because my 95-year-old sister got the vaccine and said it was safe, then that allowed me to get the vaccine. We know that there's a digital divide. There are individuals that are not going to hop on the phone line. So we have our staff going door to door with an iPad, scheduling the appointment. We're giving them their time. We're following up with them. We're doing a phone call. But we're also really mindful of the fraudulent scams that are being directed at our seniors. So we're really being mindful about how we're doing our outreach and what we're saying to them. We're letting our seniors know that they should not be giving out their social security number. They should not be paying anyone or anything. And we're working through the tenants associations. And so Ms. Barber, who is the tenant association president there at Sheepshead Bay Nostrum Development, has really been working with us to make sure that we are getting to all of the units and signing up our seniors. And we're doing this in Van Dyke and Brownsville, Polo's Ground, and so many other developments as well. And we're continuing to expand to other developments. And I think this is the way that we can really show our residents, our New Yorkers, that we're really looking for ways to take care of them.
Thank you so much, Dr. Easterling. And Wendy put in the chat, everyone, Polo Grounds has a vaccination site for our uptown residents. So thank you so much, Dr. Easterling. Are there any last words you'd like to say before we sign off?
Yeah, I just want to thank you again for the time, and I'll continue to also say, I mentioned that vaccines are safe and effective. Vaccines are also no cost to anyone. And so I've alluded to it earlier that no one should be paying any type of fees. And then the second part is that we're being also very mindful about how we're reaching out to undocumented New Yorkers. Vaccines do not fall under the public health charge benefit rule. And so we're really working with organizations to ensure that we're getting to our undocumented residents.
Thank you so much, Easterling. Thanks for joining us. And I hope this is helpful for all of our members. We will get other questions that didn't get answered. We'll work on getting them answered offline. So thank you very much.
Thank you very much. And we really appreciate it for coming by and giving our members a full lowdown on the vaccination and all the processes that go along with it. So moving forward in our meeting, thank you very much. Moving forward in our meeting, today we have our elections for our new planning committee. We're going to put in place the elections, and we're going to allow our people who are interested, who wants to be a part of the planning committee, to actually do a 2-minute presentation. And after that, we will be doing a voting piece. You guys get to vote on that. And then we're going to do a lobby day. And then we're going to have our presentation on out of gas. So we're going, those are the last 3 things that we're gonna have, and I plan to have that done by 12 o'clock. So please hang in there. All these things are so important to what we do and all the work that we do around WEAC. So Brittany?
Hi. Thank you, Charles. Good morning, everyone. This is Brittany Goodwin. I am a current member of the Planning Committee, and I'm going to introduce the candidates to you. Our first candidate is Nohimi Aguirre.
All right, so I just got a text, unfortunately, from Noemi that she has withdrawn. So let's go to the next person.
Okay. Next up is Nicole Byron.
Hi, everybody. So my name is Nicole Byron. Thank you all for having me here today. I'm really excited to be a part of WEAC. I live in Central Harlem, and I joined WEAC about 6 months ago. A little bit about myself. I have a degree in sustainable energy management from SUNY Environmental Science and Forestry in Syracuse, New York. During my college experience, I got very interested in solar energy and was thrown into the industry right after I graduated. I currently work for a solar company that services New York, New Jersey, Massachusetts, and Connecticut. And I am the director of their customer experience team. I basically lead the customer service team as well as the field coordination team that services and educates solar customers. My favorite part about my job is I'm able to speak to different people in different states and explain the benefits of going solar. And in my position, I am interacting with a lot of people, and I noticed that we have a very small number of minority customers. And this led me into looking into environmental justice and social justice and how those two work together. You know, because to get solar, you have to be a homeowner, you have to have a certain credit. So I've noticed that these same type of things that are holding people back to get solar also in place in people's everyday lives in minority areas. So I looked into WEAC, and I was really excited to be a part of it, learn more about how WEAC is helping their community, Harlem, the world. And I'm really excited to get more involved and be a part of the planning committee. So thank you all for having me today. And if you have any questions, I'll put my email in the chat and you can reach out to me.
Thank you, Nicole. Our next candidate will be Libby Jackson-Diagne.
Good morning, everyone. Happy birthday to me. As you can see in my bio, I turned 55 today. So I did what every Aquarius born on February 13th would do. I researched the meaning of the number 55.
Happy birthday.
Thank you. The number 55. It's about independence. It's about freedom to explore new areas of human experience. 55 is outward looking, forward looking. 55 desires and anticipates new experiences and new learning. And it's adventurous and it's self-sufficient. This is really important to me today because this expresses exactly why I'm here desiring to be a part of the planning committee. I'm here to experience new things. As indicated in my bio, WEAC will allow me to experience new ways of serving my community. I'm here to learn new things. I find conversations around sustainable energy fascinating, and I believe that understanding the importance and all of the efforts toward achieving sustainable energy is one of the greatest challenges facing humanity in the 21st century. I'm here because I am blessed to have the freedom to explore these new things in the second half of my life. And WEAC just happens to be the organization I choose. I choose WEAC because Since January 12th of 2018, somebody by the name of Charles Calloway had been sending me emails and texts inviting me to WEAC meetings on a regular basis, and I never joined. Until November 14th, I hopped on a call, and it turns out that that was the day that members were speaking of the recently departed Cecil. As I respectfully listened to this person that I did not know, I thought, oh my goodness, I can't believe that I finally came to a meeting and the guy who was emailing me all along had died. Then after I hung up the phone, I went back through my email history and saw that it wasn't C. Cecil, it was Charles. I knew it was a C though. And now I know that WEAC are C people, and C people are important, committed, community-oriented, and change agents, and I want to be a part of it. Thank you.
Thank you, Libby. Our next candidate will be Vivia Morgan.
Vivia, are you here today?
Sorry about that.
Okay.
Yes, I was muted. Thank you so much. And Libby, I can say I experienced the same thing with receiving the emails, and I'm here now, like you, right? So my name is Vivia Morgan. I'm a community advocate. I work as the director for Friends of Wingate Park, a local non-for-profit organization in Brooklyn. We advocate for the renovation of Wingate Park, and the mission is basically working towards the educational, cultural, and social issues that our young people are experiencing. We advocate stop gun and gang violence. And when I received the email from Charles, and I realized that they're basically doing the same things that we're doing over here in Brooklyn, I finally decided, you know what, I'm gonna do as Libby did, listen to the call and come on the meeting. So I am really excited that I'm here, and I took the time to actually finally join the meeting. And from what I've experienced, I am so happy that I did, and I look forward to participating and working in with WEAC, and I thank you today. Thank you.
Thank you, Vivia. Our next candidate is Tanetta Newton.
Tanetta, are you here today? Are you unmuted? We have her in the...
We'll go to Russell if she's not here.
All right, let's go to Russell. Russell, you gotta mute yourself.
Good morning. Okay, good morning. Can you guys hear me?
Yes.
Good morning to my WEAC family. My name is Russell. I'm a Nitro resident. So here we go. Since joining WEAC for Environmental Justice in 2018, I know that the time has been well spent and has changed the trajectory of my life. I've become inspired and a student of environmental leaders like Dr. Robert Bullard, the father of environmental justice, and Peggy Shepard, my queen, who helped to co-write the 17 Principles of Environmental Justice, and the late Cecil Corbin Mark, may he rest in peace, and so many others there. I have proven myself in the past doing phone banking, data entry, manning tables at community events, street outreach, and even giving a speech during the lobby day outing on the $1 Million Steps in Albany, New York. WEAC, being a community and grant based organization, inspired me to write my own grant proposal, in which I received a grant for $1,000 from New York City NYC Green Relief Fund and Partnerships for Park, and created 156 square feet of plantable space by making raised and elevated gardening beds during the COVID-19 pandemic on NYCHA's property in September of 2020. I am currently running for the TA president at my standalone NYCHA development, which does not have a duly elected resident council or official representation. But what they do have is me, and I got I am someone who is not only aware and knowledgeable of Nigeria's proposals to end public housing as we know it, but I stand in staunch opposition to blueprint for change and any form of privatization for there. So please elect me to the planning committee in order to carry on and out WEAC's environmental policies, and also inspire others in my community, and especially the tenants of nature, to become aware, involved, and join in the fight against injustice in Black and Brown low-income communities everywhere. Thank you very much, folks, and I'm sure you'll do the right thing. I approve this message.
Thank you, Russell, and thank you to everyone who has spoken for your quick and precise speeches. Now I'm going to give a call back to Charles, who's going to inform you on how to cast your votes for the candidates.
Okay, thank you very much, Brittany. Great job and for listening to our meeting. Blaine, can you put the link in the chat? How to vote. So everyone, the only thing you have to do is we'll put the link in the chat right now. Click on the link, and you only have to do is put your email and the person that you're voting for. So that will take place right now. Is that in the link?
Did you already vote? You already voted.
All right, let's see if it's in the chat.
Yes.
Okay, thank you very much, Blaine. So everyone should be doing that right now. It's not that it takes easy. We're going to actually leave it up for the rest of the week. It will be on the website, correct, Chris? And if you want to vote for it, you can actually vote on the website also. So we'll have a week. So next membership meeting, we will introduce you to our new planning committee. Okay? The next thing on our agenda will be a lobby day. And Sono, can you talk about the lobby day?
Yes. Hi, everyone. So I'm just going to, oh, perfect. Thank you, Bleen. So we have a lobby day coming up, everyone. I know a lot of you love attending these with us. This is going to be a virtual lobby day, so it's going to be Zoom. We're not driving to Albany on March 2nd. Hopefully we can do that again in the future, but for now, this is all a virtual lobby day, and it's about toxics. I know a lot of you care about getting toxic chemicals out of our products, which harm our body when we ingest them, or when we put them on our skin, or when we yeah, those are really the two ways, drink them. So let's be careful about toxics. So the two things that we're talking about here and lobbying for with our state legislators on March 2nd are about removing toxic chemicals from our personal care products. Our personal care products are things like our beauty products, our toothpaste, our shampoos, anything we use to kind of take care of our body and clean our bodies. There's lots of toxic chemicals in them that can lead to negative health effects, such as just, eczema and allergies, but it also can hurt your endocrine system. It even can lead to cancers at some point. It can hurt your neurological system. So we really want to make sure that these chemicals are not in our products, so that when we buy our products and take them off the shelves, we're not worried about all these harmful toxics getting into our bodies. The next thing we're advocating for with our lobby day is about removing lead from school drinking water, public school drinking water across the state. We are trying to get lowered the amount of lead that is allowed in water in our public school drinking water. It should be no lead allowed. We know that lead poisoning, especially for children, leads to a lot of developmental issues that can last through the lifespan. And we know how to get rid of lead. We know what needs to be done to remove it from our school drinking water that comes through our pipes. So those are the topics that we're lobbying with. So on March 2nd, if you'd like to sign up, and I'm going to put the sign up form in the chat, but you can also just email me if you're interested in hearing more or want to sign up. It's going to be March 2nd. We're going with a big coalition that we work closely with called the Just Green Partnership. And what we will be doing here is we'll get at 10 o'clock when you join, we'll get a little how-to. If you've never lobbied before, do not worry about it. You will get information about how the program works. But basically, we will be going into different Zoom rooms where our state assembly members and senators are sitting, or their staff members, and we get to tell them our own stories of why they should be banning toxics from personal care products, getting rid of lead from school drinking water, and really just trying to convince them and make the case from our own experiences of why this is important. So that is really what we're doing over Lobby Day. So that happens from about 10:30. We meet with about 4 or 5 legislators, then we get a break, then we do it again. I'll say, we're on Zoom here. If you can only come to some of it, that's okay. If you only want to try one and see how it goes, that's okay. If you want to come for the whole thing, that's also okay. We have some flexibility here. So just sign up if you're interested, and even just attending one session with your legislator and talking to them about this, and see how it goes. So please join us. I put the link in the chat. It's March 2nd, Tuesday, March 2nd. Or you can email me, sonal@weact.org, if you just have questions, want to talk about it, or might be interested. Thank you all.
Okay, thank you very much, Sono. Please, people, sign up for the lobby day. It is very important. Yes, please do that. And we were going to, last presentation that we have today will be UA for out of gas. How we're going to combat the climate change effort that we're going to be doing. So UA, are you ready? UA?
1 second, I'm trying to get it up.
Okay.
You have it open yourself? Because I see 2 of them. No, I got it. Never mind. Thank you.
Got it?
Yeah.
All right, we need to mute Russell. Someone mute Russell, please.
Okay. Let's see. My notes going. Can you see the presentation? Yes.
You are a go.
I'm a go?
Yep.
Okay, great, perfect. Welcome. My name is Yua Vosper. I am the Environmental Policy and Advocacy Coordinator with We Act, and I'm going to give a brief, broad overview of our education pilot, which is called Out of Gas and with Justice. What is Out of Gas and why are we doing it? Well, we're a collaboration of environmental justice advocates and organizations. Buildings are among the biggest source of greenhouse gas emissions because New York is primarily real estate. We have more buildings as a larger city would. But these buildings emit heating and cooling inefficiently because of the old housing stock and other factors such as old windows, appliances, and inadequate insulation. With the Climate Leadership and Community Protection Act, this is going to transform the way we generate and use electricity. It's going to transform the way we heat our homes. It's going to transform our transportation. It's going to transform our way of thinking even. 70% of New York City's air pollution comes from buildings. 70%. 1 billion. New Yorkers burn more than 1 billion gallons of heating oil every year, which accounts for nearly 14% of pollutants brought into the air. In fact, buildings produce more pollution than all cars and trucks in the city combined. What we will do, we will swap out gas stoves with induction stoves and install heat pumps. So we're replacing gas stoves with electric induction stoves, and we're going to install heat pumps, air source heat pumps. And I'm going to explain what those are later in the presentation. We'll launch a 6-month research demonstration that will monitor the indoor air quality. We're going to evaluate cost, and we're going to educate residents, our participants, about the use and the benefits of electric induction stoves and air source heat pumps. We're going to do this in 2 locations, New York City and Buffalo. We're going to have 40 total participants, but we're breaking them down. We're dividing them evenly, 20 in New York City and 20 in Buffalo. And of the 10 will be a control group and the other 10 will be experimental. And we're going to perform this replacements in multifamily affordable homes. We prefer a child with asthma that is present or a household member with a respiratory issue. And we're going to tell you why later in the presentation. But most importantly, this educational pilot study is going to ensure equity. Low-income communities and communities of color are some of the first to, we want them to be the first to experience these electrification upgrades at little to no cost. Low-income communities often receive limited or delayed funding, and many don't see these improvements. And we want the community, our community, to see these improvements, experience these improvements, see the money come to them, and have a better quality of life as a result. And I'm going to show a quick video with an advertisement.
For more than 10,000 years, the average global temperature
really important when you do the next exercise. But what happens if we decarbonize?
Remember, carbon emissions come from the burning of fossil fuels, this stuff. And Saul says that means that to decarbonize, we just need to follow their path. The first place that leads you is here, with electricity and the energy we use to generate it, the majority of which in the US comes from 2 kinds of fossil fuel, natural gas and coal. If the US wants to decarbonize, it needs to stop getting electricity this way and to replace it with other decarbonized energy sources. That means coal power plants, gone. Gas power plants, gone. All electricity would come from renewable sources: wind, solar, geothermal, hydroelectric and biomass, or nuclear energy. Decarbonizing the way we get electricity would be a huge investment, but it would only eliminate 20% of emissions. And that's because electricity and energy are not exactly the same thing.
That doesn't solve the vehicle's emissions. It doesn't solve your heating emissions from using natural gas or fuel oil in your basement.
All these other parts of the economy draw their energy directly from fossil fuels. Like transportation, we use oil for fuel, and commercial and residential buildings where we use gas and oil for heat. But Saul says there's a kind of elegant solution to this. You decarbonize these sectors by switching their energy source from here to here. Make all of it electric. Because we already have almost all the technology we need to do it.
Heat pumps, batteries, electric vehicles, wind turbines, nuclear power plants, as we know that can work. We know we can do electric cars. We know we can do electric heat for nearly everything.
It's all, in the end, just about machines.
a bunch of machines that use fossil fuel energy. We need to replace them with machines that use clean electricity. And so it really just comes down to a matter of industrial capacity. How
For more than 10,000 years, the average...
There we go. So that was a brief video, kind of showing you our thought process. Basically, we are trying to move toward electricity. One of our We Act co-workers, I'm gonna cite something Chris Dobbins has said. It's basically the way we used to think about, we could think about an electric car. Now we see more electric cars on the road, and we see GM making hybrid cars and cars running with electricity. Well, it's kind of the same thing. There's really no need to have a gas stove when we can have an electric stove that is more efficient and has clean, and it's it's not producing so much pollutants inside of your home. There's no reason for us not to have an electric source of heating and cooling. Whereas we can have, a boiler system. We don't need those things. We can upgrade ourselves. We can have these state-of-the-art appliances. So I have a little quiz. So I can't see you, so I'm going to rely on the chat or someone to yell it out. I don't know. We'll see how this goes. So I have question 1, and I didn't know how to play the music, so I'm gonna make the music with my voice. So who can answer? What is electrification? Is it A, removing natural gas from a building for energy use? B, removing lead from a building for energy use? Or C, removing mold from a building for energy use? And I'm going to the chat. Oh, we have a round of A's. Let's see if it's right. See if this is right. Yes, yes, it is. Yes. Woo, woo, woo. You can't hear it, but pretend there's a good game show music going on. Okay. What is decarbonization? Is it A, refers to the reduction of eliminating carbon monoxide and lowering the use of fossil fuels? B, refers to the reduction or elimination of carbon dioxide and lowering the use of fossil fuels? Or is it C, refers to the reduction of eliminating of gas carbon and lowering the use of fossil fuels? Give everybody time to respond. Okay. Let's see. Oh, we have a variety of answers. Let's see. Okay, for this one we have C. Let's see. Oh no, oh no, that's okay. We have a second chance to get it right. What is decarbonization? Is it refers to the reduction of eliminating carbon monoxide and lowering the use of fossil fuels? Refers to the reduction of eliminating carbon dioxide and lowering the use of fossil fuels? Now we're down to A or B. B. Most people said B. Let's see what that means. Yay, yay. B is the correct answer. So yes, it is B. Decarbonization refers to carbon dioxide and lowering the use of fossil fuels. And that's a good point, because many people don't know what the true definition of decarbonization. So I'm glad that we all had a chance to participate and learn about that word today. So why does it matter? Well, the United States Environmental Protection Agency reports that Americans spend 90% of their time indoors. So it probably has gone up more since we're all indoors now with COVID-19. The EPA does not regulate indoor air quality. The indoor air pollutant levels can reach up to 2 to 4 times higher than outdoor air pollutant levels, and that can go even higher. So what is indoor air quality? This is the air quality in and around building structures, especially as it pertains to health and comfort of you in the building. So what's important is that we know, understand, and are able to control our common indoor air pollutants, which could help us reduce health issues. So smoking, mold, some air fresheners, some strong household cleaners, carpeting, and certain perfumes can all infect indoor air quality. Poor indoor air quality can contribute to infections, allergies, chronic lung conditions, lung cancer, and other illnesses. So even though the EPA has identified mold and other factors as serious concerns, most of our indoor pollution comes from burning things. And this smoke is often invisible. So most of the pollution comes from gas and propane. Homes with properly functioning gas stoves already have a poor indoor air quality. So imagine if there's a malfunctioning or inefficient gas stove, and imagine the higher levels of indoor air pollution that they could emit. And sometimes this becomes so high, it becomes at a level that it would normally be considered illegal outdoors. The impact on low-income communities. Household size can directly influence environmental exposure to indoor air pollutants. These are smaller unit sizes, more occupants in the home, and inadequate stovetop ventilation contribute to higher levels of pollution in multifamily buildings. As we're going to say throughout the presentation, some households use their gas stoves as a secondary heating source, leading to greater exposure to pollutants. This is a response to malfunctioning, inefficient, and broken heating systems. Households often use gas stoves as a secondary heat source with windows closed to retain heat, which creates a longer exposure to poor indoor air quality. Ventilation. Major gas appliances found in the home are required to be vented outdoors, except for gas stoves. There are also no standards to ensure the venting works, or when it turns on, that the venting pollution levels are unsafe. Properly installed and maintained exhaust hoods over or behind stoves can reduce pollutant levels and is associated with better respiratory health. Many households sometimes do not feel they need the fan or that the fans are too noisy. So exhaust ventilation cannot be relied on to protect families from unsafe gas stove pollution. And just for a side note, if you do have a gas stove and a ventilate exhaust hood at the top, turn them both on. So turn on your ventilating hood and open the window. The two measures can help reduce the amount of indoor air pollution. So let's talk about the swap out. So what we want to do is replace the gas stove with the state-of-the-art induction stove. Oh, it's not moving. There we go. So this is a kind of a diagram of what an induction stove would look like. And I like this because it really breaks it down what's going on underneath, because what's going on underneath the hood is what's important. So the surface will not become hot, this part. Underneath is where all the action is. It converts electricity into a magnetic field that is used for cooking. So the induction cooktop cuts out the intermediate step of heating up a burner, having to burn a gas flame, and then transferring the heat to the pot. So this is the main reason why, if you take the pot off, the surface won't become hot, because it's only transferring heat to the pot. So heat produced goes directly to the cookware. Since there is no direct heat, the induction stovetop is safer. Even if you take the cookware off, as I said, the heat stops because the heat is going directly from the stovetop to the pan. All the action remains below the surface. The surface is where we cook and it remains cool, so you can even touch it. It's also safe for children. The child can put their hand directly on the cooktop and there will be no heat. And if you spill some sauce, you can just wipe it off because it's not going to burn and stick to the surface. So what does this mean for our health? Gas stoves are a large source of toxic pollutants indoors, as we just discussed earlier. And as we just discussed earlier, indoor air pollution is not federally regulated. Individuals, particularly children with asthma, have breathing issues in the home because of the large amounts of indoor air pollution gas stoves emit. And if they're already getting poor indoor air quality and outside air quality is poor, then this results in sometimes repeated emergency room visits, repeated medical bills, higher medical bills because of these emergency room visits. So what are we trying to do is ensure that everybody has good indoor air quality, can breathe in their home, a great quality of life, and that we are giving people an opportunity to live healthfully. Low-income households are at a greater risk of exposure to pollutants from gas stoves because many individuals use gas stoves as a source of heat, as we explained earlier. This causes elevated levels of hazardous pollutants over prolonged periods of time, and that's kind of the key. It's over a prolonged period of time. It's not just one time. This is continuous, and it's continuously affecting the body. Low-income households often, as I said earlier, have malfunctioning, inefficient, or broken heating systems. So as I said before, this is a response. It's not, it's a source. It's not something that we necessarily want to do. It's in response to the malfunctioning systems that are not getting replaced and are not being upgraded and are not being properly taken care of by whoever is in charge of the buildings. Induction or electric stoves do not emit these high levels of pollutants and are safer to use. So replacing the gas stoves with electric can dramatically decrease indoor air pollution levels, not just in the kitchen, but in the overall home. And we will have sensors placed in the homes, and these sensors will monitor air quality from baseline 0 and intermittent throughout the study. So that's how we will be able to measure the air quality. So 50% of homes with gas stoves have an estimated 50 to 400% higher average indoor air pollutants than homes with electric stoves. 55 to 70%. During winter, home ventilation is at its lowest. Why? Because we want to keep the heat in. We don't open our windows. 55 to 70% of homes with gas stoves without ventilation may experience indoor air quality that will be often illegal outdoors. So this is time for feedback. So I can't really see, but I'm just gonna look in the chat. What would it take for you to switch to an induction stove? And I'm gonna give you time to answer. What would it take for you to switch to an induction stove? That's a good point, Marina. Probably own a home. That's a good point. Many people we often can't make the upgrades we need because we're renters. So owning your home, you would be able to take that control. Okay, Russell has said that some privatized RAD developments have issued electric stoves, and some residents say they are more costly, hard to fix, and most workers are not trained to fix them. Good point. And we do have a workforce component where we would be able to train people on how to install and fix with new technology and new things. There often aren't a lot of people trained in that field. And we are also putting our call to find people and contractors and installers who are experts in these new technologies and installations. So very good point, Russell. Deanna McBride said money, and I'm glad you said that because for many people, money is an issue. And that's why we're trying to give these upgrades to people who are often overlooked and not seen. And we want them to have the state-of-the-art upgrades.
Yes.
With little to no cost. Oh, an incentive program. Good point, L'Oreal. I hope I'm saying that right. L'Oreal Crowder. Larger amp capacity, Michael Scott. Yes, we are looking into that. We are trying to, we are matching the amp capacity with the proper stoves that we bought to ensure that the building and the apartments can carry the electrical load. Seeing live demonstrations. Thank you, Erica. We are doing live demonstrations with participants. When they receive the gas stoves, we will be providing them cooking classes over Zoom. We'll be providing them demonstrations on how to use. So that's a very good point. So thank you all for your feedback. That was very informative. We do, and I'm glad because your concerns are some of the concerns that we had. And as we at We Act, we love to hear from our community because you are who inform us and we want you to be able to make meaningful sound. So I do appreciate all your feedback and your thoughts, because those are the same thoughts that we have had. And I wish I could be like Oprah, you get a stove, you get a stove. But alas, I am not.
Thank you very much, Yor. We appreciate your presentation. And thank you very much for sharing all the great information that we have and how we're going to, one way are we going to combat climate change.
Okay, I haven't gotten to the air source heat pumps, but do you want me to stop? Because I can stop.
I think we may have to do that another time because how long will it take you to do the air source heat pumps?
I can just go through what it is and we can stop it right there.
All right, let's do that. And then we'll take it from, we'll be closing the meeting soon after that.
Sure, okay. Air source heat pumps are electrical powered systems. And basically what they do, it functions just as an air conditioner, but the heat pump has a copper tubing called refrigerant that carries heat. So basically, as the diagram shows, it takes whatever's outside and it adjusts it to the inside temperature. And this is an efficient way to heat the home because we replace gas boilers with heat pumps. It improves air quality. Residents have more control over their temperature, and more households will have access to air conditioning, which is health necessity during summertime. And with that, I will stop sharing.
Okay. Once again, Yor, thank you very much and appreciate your knowledge around how we're going to combat, one of the ways we're going to combat climate change. So moving forward, we are at the end of our meeting. And I want to thank everyone who's participated in this meeting. Mrs. Newton, are you here?
I'm here.
All right. I would like to, since I know you're having some difficulty getting on
yes.
to the internet, onto a meeting. So you are one of the planning committee people that we would like to do a presentation for us. So can you have a couple of minutes before our meeting closes. And that way you can kind of tell us why you want to be a part of the planning committee, and then we can actually close the meeting and continue the voting. Okay?
Oh, wow. Hi. Well, I was first introduced to We Act during COVID, and I immediately felt empowered by what We Act is about, where We Act is going, and having a voice in the environment is so important, and to see it happening from someone like Peggy Shepard and then the crew that's here has been an enormous impact on my life, and feeling like I could have a voice and be a part of this movement to help the environment. And it's particularly in the environment in the cities, as it relates to Black and Brown people and Harlem, and just in general, it's just an important movement. And so that's primarily why I felt compelled to be a part of this in any capacity. And I'm here to serve in any way. If I'm not accepted into that committee, I just want to be here in any capacity as possible. And I say that because in knowing and being a part of these meetings, I see people that have already been a part and are asking and requesting. And I think it's just a very empowering opportunity all around. So either way, I'm happy and grateful.
Thank you so very much. We really appreciate you. And And we look forward to the voting process, and we will be moving forward then, and we will be bringing back the people who have been voted into the planning committee next month. While I'm on next month, thank you very much, Mrs. Newton. We appreciate you.
Thanks.
While I'm talking about next month, I just want to make sure everyone recognizes that next month we will be having a candidates forum on the borough presidents. That's our goal. We will bring in the candidates forum for the borough presidents in March. So everyone should be looking forward to participating in that process. That will be the goal for next month and other community events that we have. But the main attraction will be candidates forum for the borough president. While we still have about 6 minutes left in our meeting, does anyone have any pertinent announcements that we can actually share with the community? And then we will close out. I know, Gwen, you always have something going on.
Of course. Hi, everybody. Happy Saturday. Good to see you all. I'd just like to invite everyone to please join us on Thursday, February 25th, 7 o'clock, for a wonderful celebration of the legendary percussionist Joe Chambers. He is that connect from the post-bebop era up to today, down to the avant-garde, and he's now in his 80s, and he's coming out with a new CD on Blue Note Records, and we are so happy to be presenting a celebration for him. It's virtual, and you can go to our website to sign up, because to join via Zoom, you have to register, and then you can also watch it on Facebook Live. But I'm going to put my web address, which is Argent Jazz Fest New York City, in the chat. It's a free event. Come out and celebrate someone who has impacted the jazz community. Thank you.
Thank you very much, Gwen. I also forgot to mention that we would like everyone to become a member. If you have not become a member, please become a member of WEAC. Bean, can you put the link for the membership in the chat? And thank you very much, Louis, for reminding me about that. Everyone should become a member of WEAC. We look forward to participating in our monthly meetings and also in other working groups that we are doing throughout the month. So please, become a WEAC member. Anything else? Any announcements anybody else likes to do or talk about that they may be having on in their community?
Sure. This is Annie Wilson, and the mayor is negotiating to purchase 600 megawatts for city operations from Hydro-Quebec that would necessitate the construction of a transmission line from Quebec to New York City. So please call the mayor and ask him to promote locally produced energy efficiency and renewable energy made in New York City in our local community, rather than importing from damaging mega dams in Canada built on Indigenous lands. Thank you.
Thank you very much. Can we talk, Sonal, you still here?
Yes, I'm still here, Charles.
Can you talk about our victory yesterday around Renewable Rikers?
Oh, yeah, certainly. So I'm sure some of you already heard, but we passed, along with a lot of our partners in environmental justice, advocacy, and organizing, as well as our amazing activists that work in prison reform or abolition or criminal justice reform or mass incarceration work, a lot of different things we can call it. We passed the Renewable Rikers Act yesterday or 2 days ago. So 3 cheers for that. The Renewable Rikers Act is a really exciting piece. Essentially, it's ensuring that Rikers Penal Colony closes by 2027, which was already a promise the mayor made. His original promise was 2026. This ensures that the penal colony closes, and as it is slowly closing, it's getting phased out. We already have thousands of fewer folks incarcerated on Rikers Island as of now than even a couple of years ago. That we replace the penal colony with renewable energy, so solar panels, potentially a wastewater treatment plant. And the point of doing this is a couple of reasons. First,
we need sources of renewable energy local in New York City. Even Annie just said it. Thank you, Annie. And we particularly want renewable energy sources for our communities that have been impacted disproportionately by the criminal justice system, by mass incarceration, by racial injustice. That's what we hope that this Renewable Rikers Act will do. It will be powering the communities most impacted. It will also be bringing up training solar installers from these communities, particularly people that have been formerly incarcerated or impacted by the system, training them in renewable energy jobs so they can be a part of this transition to a whole new growing industry and lead the industry. Another big reason why we're excited about this is because it is now a space where we can put a wastewater treatment plant and renewable energy, which gives us the opportunity to remove dirty peaker plants, which are plants located in a couple neighborhoods in New York City that are polluting the air of the communities that live around it. And removing wastewater treatment plants, you know, we have one in northern Manhattan, but there's also a lot in the South Bronx and other parts of New York City, removing those treatment plants from where people live and putting it somewhere where people do not. So we're not polluting our communities. Another reason why this is an idea that's really exciting is because Rikers Island, not just the penal colony, the whole island itself is basically a trash heap. It is emitting methane at really high levels. The buildings there have asbestos, they have mold. It is not safe for anyone to be on that island, and especially to be incarcerated there. And there's been, I'm sure a lot of you know, there's been a lot of reports, a lot of talk about how it is a violation of human rights that anyone is spending any amount of time on that island. And so we're really excited because we're not putting people in homes there where they're still going to deal with the pollution, but we're finding a good way to use this space that is going to help us combat climate change, reduce air pollution in communities of color, bring up jobs for people of color that are impacted. And we're really excited about this to move forward. So we got it passed and we're excited for the next step, and we'll keep everyone aware of how it keeps going, because even though we've passed this law, now we have to make sure it gets implemented correctly, right? We have to make sure that our city does what they promised they will do. We have to stay vigilant, so we will keep up on it. Thanks, everyone.
All right. So thank everyone so much for being here and spending this Saturday with us. As always, every second Saturday of each month, we will be having our membership meeting starting at 10 o'clock. And thank you for participating today. I believe we had a great meeting. We got everything covered. And thank you, WEAC family, for coming out. And we will see you at our next meeting in March, where we'll be having the borough presidents candidates forum, where we'll be asking them important questions. And everyone have a great day.
Thank you.
Thank
And
you.
let's continue to fight for our political prisoners.
Yes.
Bye, thank you.
Thank you.
Thank you, Charles. You, everyone. So much.
Bye, everybody.
Bye.
Bye-bye.
Peggy
Take care,
here. Hi,
Lorraine.
Peggy.
Bye.
Bye, everyone.
Hi, Peggy.
Thanks,
You
everybody.
know, Russell, I love the
Goodbye, everyone.
Thanks, Charles. Take care.
Bye,
Hi,
Juan.
Jules.
Bye, everyone. Bye, Gwen. Bye, Bailey.
Bye-bye.
Bailey.
Bye, everyone. Be well.
Bye, Juan.
Evelyn, is Evelyn here? Hi, Evelyn.
Call the governor to stop the North Brooklyn pipeline. Call Governor Cuomo. Thank you.
Yes.
Stop that
Happy
pipeline.
Saturday,
And everyone, happy Valentine's weekend.
Oh,
Yes,
yes,
yes.
Valentine's Day.
Valentine.
Hey, Gwen.
Is that Carolyn Johnson?
Yes,
Hey,
ma'am.
Carol, how you doing?
I'm great.
Great job, you.
Good to see you.
Great job, Sonal.
Yes, great job, Sono. Yes.
Yes,
And
thank
you,
Yes,
you
let's
are.
give it up
You
for our
are.
Thanks,
Sonal.
everyone. Good job to everyone else. Thank you. You all. Great presentation.
Yep, great job. Staff
You
stay
are
on
for
the
borough
line.
president. Yay.
Staff stay on the line. All
Yes,
staff.
you are for Manhattan BP.
Yes. And Sonal, you could be the commissioner of whatever the commissioner's job is.
Yes.
Yeah, I'll stay in the
Hey,
background.
Juan Gorez, president
Yes,
of the
yes.
planning committee. Hey.
Hey, who's that?
Everyone, good luck. Everyone is so great. Can we vote for more than one person, Charles? That was my question.
Nope.
No.
No.
Nope.
What?
Trying to come in.
Right.
Where's Christopher?
I'm right here. Yeah, it would be great if we could y'all could vote.
Policy team, we repping our shirts. Policy team, go ahead. Rep the shirt.
One person, one vote.
That's right.
You could always rank them though. You could do a ranking of all.
We could have done that, and I was thinking.
But
We were going to do that.
That's all right.
What
We
happened?
were going.
We'll do that. We'll do that with something else.
And one voice, one choice.
Well, they're all great choices. So good luck, everybody.
No ranked